days. Okay, with that, I'm going to welcome everyone again to our informational session entitled Telemedicine Center to Support Sexual Assault Evidence Collection. Today's event is hosted by the Office for Victims of Crime and the National Institute of Justice with assistance from the ASH Center's Government Innovators Network. Marnie Shields, who is an attorney advisor to the Office for Victims of Crime, will be starting us off today. Marnie?
Hello. Welcome very much on behalf of the National Institute of Justice and the Office for Victims of Crime to our webinar. We're extremely happy that you could all join us. We're so excited to see how many people are here with us today, and also the wide variety of different disciplines and how far across the country and even other countries people are coming to this webinar. Also, thank you very much to the Kennedy School for hosting this webinar with us. I wanted to give a little background on what this webinar is about and what it isn't about. We have a solicitation right now for the Sexual Assault Forensic Medical Examination Telemedicine Center, and so we're here today to tell you about that solicitation, what the requirements are to apply under that solicitation, and answer your questions about it. This is not an educational seminar on telemedicine or sexual assault forensic exams or anything like that, but we're hoping that this solicitation is going to be a very exciting opportunity to learn more about opportunities for telemedicine and sexual assault forensic exams. Just to let you know, Chris and I are both in the same room, and so there might be some delay in answering your questions because we'll be sort of looking at each other and pointing and figuring out who's going to answer what as the questions come up. We might also not be able to answer all your questions right here and right now, in particular due to time constraints, but also there might be some things that we're going to have to take a little more time to think about and get back to you on because we want to make sure we give you the best information possible. But in either case, we're going to develop sort of a frequently asked questions sheet, and we will be posting that on the OVC website in the same place where the solicitation is now posted. And we'll be getting that up as soon as possible after this, hopefully within like 2 weeks, although I can't make any promises of exactly when that happened, but sort of stay tuned on the website and we'll get that up as soon as we can. So the next thing is to give you a little brief information about the Office for Victims of Crime. We administer something called the Crime Victims Fund, and we support a broad array of programs basically focused on helping all types of victims of crime to help them rebuild their lives. And with that, I'll turn it over to Chris to introduce herself and tell you about the National Institute of Justice. And yeah, there we go.
Hey, excuse me, I'm just getting over the flu from last week, so if I start coughing, I'll try to mute my coughing while everyone is on the line. But I am so pleased to be with all of you today at this with this webinar. We are particularly excited at NIJ about working with OVC on this really exciting and important initiative. And I am going to ask Jessica from the ASH Center if she can actually take off the profile slide and switch back to our PowerPoint. Jessica, can you do that? Wonderful. For those of you who are not aware, the National Institute of Justice is the research, thanks very much. I'm going to just kind of go through this a little bit. There we go. Is the research, development, and evaluation arm of the Justice Department. And what we do at NIJ is we fund research that runs the full spectrum of crime and justice, from victimization to prosecution and defense, and to corrections and forensics. And NIJ uses social science, technology, development and testing, and forensic science to better understand the factors that impact crime and justice. as well as to build evidence to learn about what works and what doesn't within the criminal justice system. We place a very heavy emphasis on dissemination to the field and sharing our research findings with the field through various dissemination mechanisms, such as our website, e-blast, document distribution, and webinars like this one. And through our research, we found that that in the field, when sexual assault forensic nurse examiner programs are used, that they contribute to a higher prosecution and conviction rate for sexual assault. And many jurisdictions have instituted SANEs or SARTs that have produced best practices, like enhancing quality of health care and improving the quality of forensic evidence, increasing law enforcement's ability to refer cases to prosecution, and increasing prosecution rates over time. But unfortunately, many U.S. jurisdictions don't have access to trained sexual assault nurse examiners, to sexual assault forensic examiners, or to sexual assault response teams. And that's mostly due to distance challenges or lack of resources. So telemedicine offers a manageable solution to this problem. And what we have found is that there appears to be a lack of these services offered for adult and adolescent victims of sexual assault. So that's really the reason why we decided, NIJ and OVC decided to see if we could create something like this using resources from both NIJ and OVC. So the purpose of this particular solicitation is to provide live 24-hour access through telemedicine technology to sexual assault nurse examiners or other kind of medical forensic examiners for 4 pilot sites, which may include rural, tribal, military, or corrections.
So the next question, who is eligible to apply? This is listed on the cover of the solicitation, but I'll try to elaborate a little bit about what we mean by each of these categories. They're also pretty broad. You might fit in more than one category, or it might be pretty easy to fit yourself in one of these categories. So the first is states or units of local government. A state doesn't just mean like the state of Illinois, but it also includes the different component bureaus of a state, and it would include public universities. Then sexual assault examination programs of various kinds, sexual assault nurse examiner programs, sexual assault forensic examiner programs, sexual assault response teams, and also state sexual assault coalitions. Then medical personnel are eligible, and this is where I think a private university, it doesn't qualify as a state, but you might fit under one of these other categories. So you might be a medical university, so you might fit under medical personnel. If the private university has a sexual assault examination program, you might fit under that category. So you still might be able to fit under one of these other categories. And then victim service providers that are involved in treating victims of sexual assault are also eligible. Then there's some additional eligibility requirements. The first category was about the type of entity that's eligible, and then these are additional things that the eligible type of entity would need to demonstrate. So the first category is capability to provide national scope training and technical assistance. And this is important because we're looking at something that's going to be national in scope, not just across a state or across a region. And so we're going to be looking at this when we score the application in the capabilities and competencies of the applicant. And so we would be looking for things like, have you had a national scope technical assistance award in the past from DOJ or other federal agencies? Have you done other work in the past that's national in scope? Can you demonstrate that you have a capability to provide work that is national in scope as opposed to just within your state or within your locality? And then do you have sufficient partners to address necessary technology evaluation and relevant specific population populations. And some of you may have this in-house, I think particularly the universities, and that's perfectly okay. This will be addressed in your application in the MOU or Memorandum of Understanding, and you should just have the internal part of your entity that provides that sign the Memorandum of Understanding. So if it's the technology, for example, then you'd have the head of your IT sign it. If it's evaluation, then have whatever division is going to do the evaluation component sign the MOU, so that it's clear within the MOU that you have each of those things addressed, even if it's really all components of the same organization that are signing the MOU, or it might be that some of the partners are internal and some of them are external, as long as it's clear that you actually have sufficient partners to address each of those things.
So we have 3 goals for this project. The first is to create a national telemedicine center for adult and adolescent sexual assault forensic exams. We've decided at this point in time, we are not going to be focusing on pediatric sexual assault examinations. And we want the center to have the capability of being open 24 hours a day, 7 days a week, and to be able to provide access to highly experienced sexual assault nurse examiners and forensic examiners. We want this center to be able to provide the technological capability that will enable them to directly assist in exams in real time conducted at the pilot sites.
So here's what we're looking for in terms of deliverables. There will be development of protocols and procedures for operation of the center. What this means is we're not expecting when you apply that you're going to be able to say right away, here's how this is going to work, here's exactly what's going to happen. But these will be developed during the first year of the grant. So that's going to be one of the deliverables, is coming up with those protocols and procedures. We expect this to be a deliberative process. There's probably going to be a lot of issues that will need to be thought through. Things like, how do you handle informed consent when you have somebody that's on the other end of a camera that's in the room with a patient? Those kinds of issues will need to be thought through as part of the protocols and procedures that will be developed in the first year. The pilot sites will be selected down the line. So again, that's not something that would be identified in the application at this phase. You wouldn't say, we have these 4 pilot sites, they're already partners. We're expecting that you would work with us to develop a solicitation, and those would be competed down the line. We are also expecting a staffing plan. Again, that's not something you have to have now. It's going to be a deliverable in that first year. And then technology and equipment purchase, and the process evaluation, which Chris is going to tell you about.
As I mentioned earlier, that NIJ is the research and evaluation agency for the Department of Justice. So you can imagine that evaluation of this project is a really important component for us. And what we've decided to focus on for this particular phase of the project is a process evaluation. And what a process evaluation does is it documents and analyzes the development and implementation of the program, so you can determine whether the strategies that you've put into place are actually, they were implemented as planned, and whether the expected output was produced. So is the project doing what it was anticipated to do? So, for example, you would want to be able to measure these types of outputs: the number of victims served through the telemedicine center, the number of sexual assaults that were reported to law enforcement, prosecution outcomes. These are just examples. You may have more. And other elements that are part of a process evaluation include descriptive information. So a description of the program environment. What does it look like? How does it work? How are the operations moving along, and what are the different pieces of the operations? And documentation of the process is extremely important. So we recognize the fact that not everyone is going to have an evaluation component within their existing organization. So this is why we have determined that partnering with an organization that does have the ability to do process evaluations is critical. Now, if you are an organization that does have that component, you need to be able to demonstrate that they have the independence to be able to do this in the proper way. So that is also going to be an important component.
So the way this will work is that OVC will make a single award of up to $3.5 million. And as I alluded to before, the first year is going to be a planning year. And during this time, the grantee is going to issue a solicitation for the selection of the pilot sites, develop those protocols and procedures, identify, purchase, and install the technology, and begin the process evaluation. There's going to be a workshop at OVC within the first 60 days of the grant, and so the budgets should include funding to bring key partners and key staff to this workshop.
And that will be held in Washington, D.C.
So the application must contain a memorandum of understanding with your proposed partners. Letters of support do not count. It has to be a memorandum of understanding, and it has to demonstrate cooperation with partners for the technological capability, the process evaluation, and the relevant specific victim populations.
Okay, so let's talk about time frame. The solicitation, as you know, is out, and it's going to be closing on the 8th of May. And as soon as the solicitation closes, we go right into the next phase of peer review and making decisions about awards. And that is going to happen, we've got that time to between May and June. And then there is a lot of process on our end. We make these decisions, and then we have to run budgets through our Office of our Chief Financial Officer. We run everything through our Office of General Counsel. For those of you who have had grants with NIJ, OVC, or other Department of Justice entities, you know the drill. But we won't be able to make a final award decision or announce that decision until September, and that usually is right at the end of September, which is the end of our fiscal year. So October 1st is going to be the start of the project period. And we expect to be holding the workshop in Washington in December of 2012. And then taking the project a year from its very beginning is when we expect the implementation phase to begin. So what we've done is we have provided you with the URLs for both the Office for Victims of Crime and the NIJ websites. The solicitation is on both of those websites under the Grants and Funding sections. As Marty mentioned earlier, based on the questions that we get today, we are going to be developing a set of frequently asked questions, and we will be uploading those to both of our websites. They'll be located in the same area where the solicitations are located on the web. We're also going to be putting this webinar online so that if there are things in here that you have colleagues you wanted to share it with, new applicants that weren't able to participate today, that will be available to everyone. And then throughout the solicitation, you will see that there are further readings that we've identified on both sexual assault and telemedicine. We didn't do an exhaustive bibliography of those resources, but we did feel like the ones we identified in the solicitation might be helpful to you. And then you can always search our websites for even more information about sexual assault.
So that concludes the kind of prepared section of our presentation, and I see there's already a couple questions up there. So we will go ahead and start taking questions.
The first question that we have received is, can a program that serves pediatrics and adolescents partner with adult-adolescent programs for this project? And my answer to that would be yes. Yes, absolutely.
As long as the focus of the project is on adults and adolescents.
Okay. The next question that we have is, would we need to purchase technology before receiving any grant money? No.
You would need to include in your budget an estimate of the cost for the technology, so you would need to at least have some idea of what technology you would be using and the cost of that technology, but you certainly would not purchase it ahead of time.
And the second part of that question was, do we recommend that you identify a satellite telecommunications company or contract with an active telemedicine program? I guess what I would say to that is that we expect you to partner with some kind of technology partner. And whether that's a telecommunications company or a telemedicine program, of course, the technology is a critical aspect of this project. So you must have that as part of your application. I hope that answers the questions.
So the next question asks about how to say more about the MOU with respect to the relevant specific victim populations. And we would ask that you think about what specific victim populations would be relevant to this project. Certainly, we're identifying that there's likely to be tribal, rural, and correctional pilot sites, and so we would expect that you would have expertise represented in those particular populations. But we also had a question from someone asking, would it hurt to talk about other specific populations like victims with disabilities, victims that are hearing impaired, victims that are limited English proficient, and it would not hurt to talk about those victims as well. But if you do say something like, we're going to serve victims that are hearing impaired, then we would expect that you would have the expertise to serve those victims and that you would demonstrate that expertise.
Another question that we received is, how specific do you want the equipment details to be in the grant application? Marnie and I will probably talk this through as we're talking to you. But my feeling is you do need to demonstrate that you will have access to the equipment that is needed to set up the telemedicine center and be able to provide the equipment to the pilot sites. So it's going to be important that you can demonstrate that in some way rather than just saying that you have that capability. So you would probably need to expand on it a little bit. I wouldn't go into too much detail around the technology itself, but you've got to find a way to demonstrate that you do have that capability.
I would add to that, though, because the Office of the Chief Financial Officer reviews all the budgets, and the budget is also a section that gets reviewed in peer review. And so in the budget, you do have to specify exactly what you're going to be purchasing and why.
Yeah, no, that's right. That's right.
So the next question asks, should we have a national focus or a regional focus? And this solicitation absolutely requires a national focus. Not only that, but you have to demonstrate the capability to provide national scope training and technical assistance. I would recommend that anyone who does not have the capability to provide national scope training and technical assistance and does not intend to provide a national focus, this is not the solicitation for you. And so you should really think carefully about whether that's your capability and that's your desire. Yeah.
The next question is, will there be funding to the pilot sites for the technology, or will this funding come out of this particular award? And the funding will come out of this award. Sorry for the delay. We've gotten a lot of questions here, and we're just trying to go through them.
The next question has to do with responsibility, and one of the things we do like to see in applications is roles and responsibilities, both internal to the specific applicant and also among the partners.
The question that's on the table right now is, do we pick the pilot sites, or do you pick the tribal rural correctional sites? And
at the time of the application, we don't want to see anything about the pilot sites. You'll need a budget for how much money will go to the pilot sites, but other than that, that comes down the line. We will be working with the recipient to issue, for them to issue, or you, a separate sub-solicitation that would then competitively select the pilot sites.
And just to clarify, the decision about the pilot sites would be made jointly between OVC and the site selected as the telemedicine center. Sorry for the delay. We've got some really specific and detailed questions that we're just trying to work our way through here.
This next question is an interesting one. They're asking, are there specific standards of care for the patients that should be proposed in the application? And basically, we're not expecting that you'll have that at this stage. What we're expecting is that you'll at least be able to identify, here's the issues. So is confidentiality an issue? Identify that. Is informed consent an issue? Identify that. Whatever you think at this stage are some of the key issues that are going to come up in the planning process, we expect you to be able to identify them and talk about how you'll use the planning process to try to work through the issues. But we're expecting that the issues you identify and other issues probably will come up during the planning process, and that the whole point of having a planning process is to work out those issues and come up with the protocols for the actual center. And so at this stage, you don't need to have the policies and protocols yet.
The next question we have is asking us to elaborate on what we mean by a national focus versus a regional focus. Wouldn't providing assistance and training using telemedicine apply equally to regional and national?
One of the things that we're going to be looking at in selecting the pilot sites is sort of national distribution, so that we'd be making sure that they're not all within a state or even within a region, but that there's some distribution across the country, and that's what we mean. So that the recipient is going to need to be able to provide technical assistance that's across the whole country, regardless of where the sites end up being.
Yeah, I think oh goodness. The main point is that we don't want to limit to regional. And And we want to be able to provide that training and technical assistance on a national scale. And the other part of this is down the line, you know, after we have tested the pilot sites, our desire is to be able to provide national assistance through this telemedicine center, whether it's through a fee-for-service capability or not. So we're thinking large scale here. Next question, asking for clarification. The budget, let me see. Just to clarify the budget, will the pilot sites be funded within the $3.5 million budget? And is that the expected 3-year budget for the project? Yes.
Yeah, and to clarify that even further, that's for the whole shebang for the 3 years. So that covers the planning phase and the implementation and the pilot sites and the evaluation and the purchase of the technology, everything. So we've had a couple of questions about licensing issues, and not being a expert on healthcare law, I can't say what the specific issues around licensing for the healthcare professionals involved in this specifically would be, other than to say that it's something, it goes along with the national scope that we would expect the recipient to be on top of this issue and to be able to know that their providers are within the scope of their license, if that makes sense.
The next question is, could you please discuss a bit more about the process of the sub-solicitation process? And, I mean, we can talk a little bit about that, but what we would do is work very closely with the selected applicant to put out a solicitation requesting sub-applicants, I guess you could say, as the pilot site. So we would be working closely with you to be able to do that. Marnie, do you have anything to add to that?
Not really.
The question that we're reading right now is about whether pilot sites have to be places that don't already have a forensic program. And by forensic program, I'm assuming that that means a sexual assault nurse or forensic examiner program. And that would a site that has nurses, sexual assault nurse examiners, but has little support be eligible as a site? And our response to that is yes, because our feeling is that there may be rural or tribal areas that have someone that is trained, but because they get so few cases, they don't have the opportunity to use their expertise on a regular basis and may need that added support to get through the exam and make sure that they're doing the evidence collection correctly.
So the next question is, for the planning stage, will all the protocols and policies have to be approved by NIJ and OVC? And that is absolutely correct. Also, the evaluation plan will have to be approved. The staffing plan will have to be approved. All those things on the deliverables list will have to be submitted for review and approval by OVC and NIJ. And those will be in the special conditions that would be part of the award.
Okay, the next question is, can you explain once the program's up and running how it will look? And how will a SANE call in, use the system when she's with a patient doing an exam? And I guess the best way to answer that is to say that's what we're looking for from you. And that's where your expertise in these areas is going to be very, very beneficial in explaining to us how you propose going forward with this telemedicine center.
So the next question asks, do you envision that the center would offer consultation on normal and abnormal findings, and if so, how would this work in the event of testimony? And this is one of those things that's going to come up, I think, in the planning stage, or that would be my guess, because I think that's just another one of those issues that's going to get worked out. You know, who would testify, who has the records, all those kinds of things.
Okay, this question, it asks, are partners expected to be working with the funder at the base of operations but are not the 4 chosen pilot sites, so that all partners are chosen and ready to attend the meeting with NIJ, and I will add OVC. In your application, you absolutely have to have identified who your partners are going to be in the area of technology, process evaluation,
And the key special
populations. Yeah, the victim populations. And we will want representatives of those partner agencies to come to the meeting at NIJ. The 4 chosen pilot sites, that is not an issue right now. That's going to come later down the line when we do the additional solicitation to bring the sites into the process. Okay, folks, we're still on the line here. We haven't left you. We are continuing to get some really thoughtful questions here that are detailed. So we just need a moment to kind of process them.
So the next question asks, is the focus on support for process, such as how to complete an exam, or for case review? And that's a really excellent question, because when you look at the models for telemedicine in this area that are out there, those are really the 2 different models. One being for more case review after the forensic nurse or doctor has completed their exam, and the other for more live support. And the model we're looking at here is for live support. So for somebody actually on the other side of a camera or whatever technology you end up using, to be there live in the room essentially during the exam to walk that medical provider through the exam, not the model of more after the fact case review.
The next question is prior federal funding of the applicant highly advised or required to be competitive? And I would say no.
The only thing I would add to that is if you had a prior national scope training or technical assistance award of some kind, it would help you demonstrate that you have that capability. but other things that you've done on a national level could help demonstrate that as well. So the next question asks, could this be a hybrid model where one of the 4 sites is providing the teleforensics, I think they're referring to the case review, and the other 3 are the real live SANEs? And the answer is no. We're expecting that all of the pilot sites are using the real live SANEs.
I think we've answered all the questions. It looks like we've answered most questions that have come in. There are a couple that we need to look into, and we'll provide responses through our FAQs. If we have not answered your question, that's why. Oh, here's another one. Does there need to be expertise with all the identified populations? Yeah, you really need to have some way of being able to have access to that expertise around the populations that you have identified in your application. Okay, folks, the questions have kind of slowed down a little bit, but we're going to stay on the line for a while longer to give you time if you've got other questions you want to formulate, or give you time to reach out to other participants if you need to chat one-on-one with them. So we are going to give you that opportunity, and we will come back in just a minute or two. One of the questions that seems to continue to come up is there may be just a confusion about what the pilot sites are, and somebody has suggested a better way to talk about the pilot sites that we kind of like, and that is the pilot sites are the remote sites receiving the support services. So I hope that provides some clarification.
The next person asked, how do you define adolescent and adult? And they proposed a specific example such as elderly. And elderly would definitely be included. Adolescent is usually defined as 13 and above, so adolescent and adult would be anything above 13. So that would definitely include elderly as well. The next question poses whether we want the applicants to specify one specific victim population for all 4 of the sites, and the answer for that is no. We actually were thinking that each of the sites would be a different population. So there might be one tribal site, one military site, one rural site and one correctional site, something like that. And so we would expect to have partners that could address each of those specific types of populations.
Okay, the question is, so my university can, as an example, partner with an exam technology organization for distance exams, process evaluation, distance education, and outreach to in-need populations. And as an example, yes, we would say yes to that question.
The next question poses whether the applicant needs to have worked with the specific populations, tribal, rural, and correctional, in the past. And the specific applicant does not need to have, but between the applicant and the partners, they need to have had that expertise and experience. So if you as the lead applicant do not have that experience, then you would need to have a partner that does have that experience.
Right now, we have no further questions in the queue, so we're once again going to step away just for a moment to give you time if you have other questions, and we will be right back with you in just a few minutes. Hi, we're back. We seem to be getting a lot of questions about the populations for the pilots. And we gave in the solicitation and in the beginning of the webinar 4 different populations that we were interested in, and that is rural, tribal, correctional, and military. So what we would be interested in is, what we're trying to do is test how telemedicine works with these 4 different populations. So we are hoping that applications will include expertise in those 4 areas so that we can test those 4 areas. Of course, if an application comes in and wants to do 2 tribal areas, a rural, and a correctional, I mean, we would consider that. But our ideal is being able to do pilots in those 4 particular populations. I hope that clears things up a little bit. One of the questions that we just received asked us if we have seen examples of this, and I'm assuming that this means this type of telemedicine arrangement in states around the country. And what I would recommend is to go back to the proposal, and we do reference several states in our research when we were researching for this particular solicitation that were doing telemedicine, but it was mostly around the area of child sexual abuse. But there has been some really good work done in those areas, and I would definitely recommend that you kind of look at what other folks are doing around the country as background in preparation for your application. We got a very interesting question here, and someone is asking about, could you look globally? And the example that is provided is a military hospital in Germany or Puerto Rico. And I guess when you're talking about technology, the distance is not really a problem. And we're talking about U.S. military hospitals in Germany or Puerto Rico. I would say that that's something we would consider.
Hello again. The next question asks if we're expecting the telemedicine staff to be SANE A certified. And I think we're not going to take a position on any particular certification, but we would certainly expect the applicant to demonstrate that the staff is qualified, and that is included that they would need to explain how and why their staff is qualified.
We received another question about the, excuse me, the 4 populations, tribal, correctional, rural, and military, and why we selected those as our pilot sites. And we selected those because those 4 populations, from what we have heard from the field, are populations that are really experiencing barriers to receiving sexual assault forensic exam services, and are having the toughest time with the resources, or because of distance, or because of other logistical barriers. So we determined that those were the 4 different populations we wanted to test at this time. We received a question about if the program is a success, deemed a success, who will be the primary funder of long-term program? And I'm assuming that what that means is who will be continuing the funding after the 3-year funding period is over, and who will that be? And that's a great question. We are not in a position to be able to think past those 3 years at this point in time. As you all know, those of you who are familiar with applying for federal grants, we're very dependent on what our appropriations are, our fiscal appropriations are from year to year. So right now we are not in a position to answer that question, I'm afraid.
So the next question asks how much detail the applicant will need to provide in their budget about the funding for the pilot sites. For example, will they just be able to say something like $50,000 per pilot site, or will they need to really break it out in specifics and then figure it out at the subgrant stage exactly how much goes to each pilot site? And the answer is you have to estimate the specifics even at this stage, so that it'll be a specific breakdown of, whatever will be the staff at the pilot site or the technology for the pilot site, but a specific budget for how much will be for what at each pilot site.
We received a question that asks if the project is a success, would the grantee be able to become a fee-for-service? And we did state in the solicitation that this is really a long-term goal for this project, that at some point the telemedicine center would go beyond the test sites and become a national telemedicine center on a fee-for-service basis. So right now the answer to that is yes. We received another question about whether there would continue to be live follow-up Q&A sessions as we move along the timetable. Right now, we do not have that as part of our plan, but we do encourage you to call us. You can call both Marnie Shields, or you can call me, Chris Rose, if you have specific questions. Marnie's telephone number, I believe, is on the front of the solicitation, but we would be happy to give you our contact information right now. Marnie, do you want to give your phone number?
Sure. It's 202-616-3609.
And my telephone number, Chris Rose, is area code 202-307-0466. So feel free to call. You can also email. My email address is Christina, and I'm Christina with a K, .rose, like the flower, at usdoj.gov.
And I'm Marnie, M-A-R-N-I-E, .shields2, S-H-I-E-L, S as in Sam, there's no D in it, at usdoj.gov. It's on the cover of the solicitation, and I'm actually much easier to reach by email than by phone, and I definitely encourage you to email me any questions you may have.
At this point, we have no additional questions, so we will, if we don't get another question in the next, say, minute or so, we will likely sign off and see, and feel free to contact us through email or telephone. So we'll give you one more minute, and then we'll come back and take it from there. Okay, this is Chris Rose again. I just want to thank all of the folks who participated in the webinar. You gave us some great questions, really good, and we are so thrilled with the turnout today. We are going to turn it back over to our colleagues at the Kennedy School, but want to thank them so very much for making this possible and being able to communicate with all of you this way to provide assistance in pulling your applications together. So we look forward to hearing from you on May 8th. And I'm going to turn it over, on behalf of Marty Shields and myself, and I want to personally thank Nancy Ritter from the National Institute of Justice, who has provided a lot of hands-on assistance